Welcome back. We've got some great things for you today that I found on TikTok that we're reacting to, and we'll be jumping right in. But first, I'm Dr. Dustin, a board-certified dermatologist, and I make videos to help support my mobile clinic where I see patients for free. So thank you for watching. Your likes, comments, subscribes, and shares do amazing things to help bring dermatology care to underserved populations. These are sebaceous filaments. And a few little whiteheads there, but primarily we're getting a lot of sebaceous filaments out of the skin here. This is a big cyst right tucked up against the nasal sidewall. That tissue is a lot thicker than people think. It's pretty deep, so getting a lot of stuff out of there. And look at that. It's like a whole friend. There's another big one on the cheek there. I don't know if we're gonna go get that, but they're still getting more out of the nose. Boom, look at all those sebaceous filaments. And he's grimacing. This is painful. Probably did a little warm compress or something to loosen these all up because they're coming out pretty easy. Obviously there's some pressure, but they got the gauze, they got the gloves. We're doing things right here. It's just that he's not having a good time with it. Here we go. And that's all she wrote. All right, now we've got for these pops. Now these are very black, so they've been there a while, and that sebum has oxidized as it's been exposed to the air, but they've got gloves, they've got gauze, and I'm thinking this is just right up on the cheek. We can see the facial hair there and the eye just on the right side. So the person's kind of upside down. But they've got some scarring here from old acne. And so even though they're decongesting these pores, getting some stuff out, the texture of the skin is still gonna be not perfect. But this can set you up to do chemical peels or laser treatments where the patient can get some better texture. But those are coming out nicely. And just finding more kind of interspersed in the hair there. Very good, I like it. Parte un cravo gigante no rosto. So I'm hoping that they've numbed him up here because they're coming in with a pretty sharp tool. They're cleaning the skin, they've got the gloves on, so this looks like a pretty good medical setting, with the exception that I don't see any drapes for what is about to come. Sorry for the needle in the skin. That's gonna get me restricted on YouTube. And they're starting to mash on this thing. Now with that needle and with the intensity with which they are pushing on him, my guess is that he's been numbed up. Boom! And this stuff starts to come out and it's landing on his neck and his face. I would be draping the patient with a towel or a sterile drape of some kind to catch all of this stuff. But the camera work is overall pretty good here. Sorry about the blood. This person has some pretty big cysts. Big pimples on the nasal sidewall. They've used a lancet, and this is not a big enough comedone extractor. They give up right away, and they're just gonna be mashing on it with the fingers. Boom, there it pops. These kind of pimples are gonna be painful for the person, like before you do anything. They're deep, they're gonna be pushing on nerves. You got the facial artery running right in there. But they're getting a lot of stuff out of there. He's grimacing a little bit. It's painful. So I don't think this person's numbed up. I don't know if this is an esthetician or who's doing this work for sure. There we go. Quite a bit to work on. There we go. This person has a ton of sebaceous filaments. They're getting kind of congested. This is more of a blackhead, whitehead situation going on that they're working on. You see as they mash that just lots of sebaceous filaments start popping up. And again, these are normal. Sebaceous filaments are not something you have to get rid of, but you can improve the texture of the skin with retinol, salicylic acid, chemical peels, whether you're doing more aggressive ones in the office or a little bit lighter chemical peels that you do at home. just to help keep the skin smooth, soft, give you that dewy look. I like that they've got gloves, they've got gauze, but they're popping a lot of stuff out of here. He's got some bigger pimples around the lip. We'll see if we're gonna go for those. They got a lot out of there. This is the same patient that we saw earlier, but we're working on the other side of the nose, getting out some of these whiteheads, these plugged pores that are hiding under there. Nothing as big on this side of the nose as there was on the other one. I don't know what all those little white dots are on the skin. I think those are from the gauze, like rubbing. I think that their gauze is like falling apart on his face. I always want to know what they pair with for skincare. Like, are these people going home with skincare to prevent problems? Are they getting better? Like, some people let this go a long time and then they're coming in and just getting everything mashed out of their face. But what's the long-term plan? That's what I want to know. And we just don't get to know that. So I tell you what I would do. Oh, he's in pain. He is not having a good time. But he's putting up with it. Ooh. I would probably not be tough enough to let someone do that to me. I do it to myself though, but I don't have skin that looks quite that bad. Sorry. Boom. A moment that felt like Hosier's yell. All right. I mean, I kind of feel that way sometimes when I'm doing extractions. It's pretty cool. Think your pores are clean? I mean, it looks pretty good. She's got sebaceous filaments. They're blowing some steam on there, and they got all of those sebaceous filaments out. So there's some buildup. Yeah, a little congested, maybe. But to me, the before and after is not that much different. The sebaceous filaments will be back in a couple days. Juicy pimple popping. But where are the gloves? They've got like tissue there. They've got a great camera, but they couldn't invest in gloves. Great camera angle here, really close. They're using those very fine tweezers. Kind of underwhelming, honestly. Just one little ingrown hair. All right, they've got no gloves and they're working on a pimple in the eyebrow. Very tender spot, I can tell you that. Oh, use gloves. Again, no gloves. I don't know why. And they're mashing on this. Maybe if you're doing this to yourself, but if it's somebody else's bodily fluids, put on some gloves. No gloves again. I don't know how you could wear them with nails like that, but you also have to think, what's under the nails? What kind of buildup and what kind of risk of infection could you be exposing someone to? Just a little juicy pimple pop, but I prefer gloves. Guys, thank you so much for hanging out and watching these reactions. Let me know your skincare questions, and I think it's about time we start planning a giveaway on this channel. We are nearing 2 million subscribers. Thank you for being a part of that journey, and stay tuned for a big skincare giveaway, and I'll see you guys on the next video.